And joining us to discuss the plan further are State Senator Graciela Guzman, a Democrat from Chicago, and State Representative Travis Weaver, a Republican from downstate Pekin. Thank you both for being here. First, you know the state's budget issues right now. Can the state find money to keep this program going, as some estimates say it's costed upwards of $1 billion?
I'd argue that it is our state's imperative to find this money. One, HBIA and HBIS, the Program for Seniors, a parallel program, have saved the state $65 million since the inception in 2021. We also have to remember immigrant spending power, $8.6 billion in 2021 alone, right? So the argument here is not only does it save our healthcare system's money, it also puts money back in our state system, because these are folks that work. They are our neighbors, they are our loved ones, they are making contributions to the state of Illinois. It is our imperative to find that.
Representative Weaver, the governor and Democrats are now echoing what Republicans have said from the beginning, that the state can't afford this. What about Senator Guzman's point that it puts money back in pockets and it helps the economy?
Yeah, well, first of all, let me just say to Ahmed and Rana, that's the first time I'd heard their stories. My heart goes out to him. It's so tragic to hear those situations. But I don't really think that this is a philosophical difference that Senator Guzman and I have, because I think we actually need to take a step further back from that. Because in February, the Auditor General released a report stating that there was hundreds of millions of dollars of waste, fraud, and abuse associated with this program from people that have Social Security numbers and were depending on it, and they're actually not supposed to be a part of it because they're here legally, they're citizens, they're not who the program was intended for. So I think we need to stop this immediately. It actually should have been stopped back in February once that Auditor General's report came out, until we know that there's no waste, fraud, and abuse. Then once that's cleared up, we can have the philosophical debate about whether it's right or wrong to spend this money, but we should not be spending money on a wasteful project.
All right, Senator Guzman, what about that Auditor General report? Is there hundreds of thousands of dollars of waste, fraud, and abuse? Millions of dollars?
As you can imagine, our Medicaid system is very complex, so is immigration status. And so it's entirely possible that someone, to Rep. Weaver's point, has a social security number, but is actually not a citizen, is not a legal permanent resident, but is simply in their process of gaining status. So the audit did find the complexities of our immigration system. Healthcare and Family Services has done an immense amount of work on top of the cost containment measures to help lower the cost of this program. We've still got work to do, but I think we can't throw out the bathwater with the baby, right? We have people that need this care now. They are our neighbors, they are our loved ones, they are our working economy. We need to continue this life-saving care.
All right, and let me play a clip from the CEO of Cook County Hospital, who basically said that cutting off this insurance would mean more people in the emergency room. Take a look.
As people lose coverage, we're going to potentially see, instead of, managing high blood pressure or diabetes, we're now treating strokes and heart attacks.
Representative Weaver, you said once the waste, fraud, and abuse is ironed out, we could talk about the philosophical debate. So say that does get ironed out. Where do you stand on the philosophical debate? Should folks that don't have documentation receive some kind of insurance?
Yeah, the answer for me is still no, and especially at the way that our budget sits in 2025, where the majority party is suggesting taxing services. So this is things like haircuts, nail salons, people that mow your lawn, typical services that we all enjoy now having to tax, which means that not only the regular taxpayer, but also the small business owner. I mean, think about these all-American startup jobs. Mowing lawns was the first job for so many people, now becoming taxed so that we can pay the health care for people that are here fully illegally. I just have a problem with that philosophically. If we had a robust budget year, I would love for us to have more services that we can provide for people. The reality is that the situation that we're in 2025, where we're taxing services, something we've never done before, so that we can pay for health care for illegal immigrants, is something that I have an issue with.
Senator Guzman, I know the Latino caucus is fighting to get this back into the budget, as Governor Pritzker's proposed cutting it. Are there sources of revenue that you can point to that might help fund it?
I think across the General Assembly, there's a diversity of opinions. I mean, personally, I know for myself, I'm trying to advance measures around progressive revenue, as are many of my colleagues, right? Because I think at the end of the day, we don't want to balance this budget on working class people. I don't want to see regressive taxes. But I also know that communities across our state have various needs, from this program called HBIA to after-school prevention money, violence prevention money, homeless prevention dollars. We are in a situation where our communities have immense need, and revenue needs to be one of the sources, to Rep. Weaver's point, that we bring to the table to bring solutions to our community that so desperately have need right now.
Representative Weaver, what about hospitals like Cook County and others downstate in rural areas that now will have to turn to charity care as folks without insurance in greater numbers turn up in the emergency room. Couldn't that end up costing more?
I would love to see the math on it. I haven't really dug into this specifically. I haven't heard from my local hospitals that would happen. If that's going to happen here in the city of Chicago and the city of Chicago supports it, I'd encourage Mayor Johnson to look into it, because the reality is at the state level, we're pretty tapped out, right? We have the worst credit rating in the entire nation, $180 billion in pension debt, property taxes that cripple so many of our citizens. At some point, we've got to decide we're not broke because we tax too little. We're broke because we spend too much.
All right, really quickly, Senator Guzman, are there votes to block the budget if it doesn't include this?
I think that we still have less than 2 weeks to go in the budget. Our Latino caucus and other folks have been in negotiations. And I think to Rep. Weaver's point, we have to remember this is a statewide issue. We have 33,000 enrollees across multiple counties, not just in Cook County. Cook County system alone, you heard it today, they will suffer some decreases in terms of what they're expecting. $110 million is their expected loss. But what we know is almost every single hospital in the state of Illinois saw a decrease between 15% and 28% for bad debt simply from having health benefits for immigrant adults. It's a program worth investing in, and I urge every member of the General Assembly to look into it.
I do have to leave it there. Senator Guzman, Representative Weaver, thank you for making the trip here, especially you, Representative Weaver, all the way from Pekin.
I know.
Pleasure.
Great to have you up here in Chicago, and we will be right back after this.